Good morning, everyone. Today's discussion focuses on the crucial role of medical evidence in cases of sexual assault, specifically concerning women and children. As future forensic practitioners, it's vital to understand the nuances of examining and interpreting findings in these sensitive situations.
Sexual violence. Sexual violence is a widespread issue that affects individuals across different ages, gender, and backgrounds. It is a crime that inflicts deep physical, emotional, and psychological harm on victims. In legal cases, medical evidence plays a crucial role in supporting victims' claims, helping to establish the truth and ensuring justice. Future forensic practitioners must be well trained in collecting, interpreting, and presenting medical evidence to assist in legal proceedings. This presentation will explore the role of forensic examination in sexual violence cases, highlighting its significance in the justice system.
The issue of sexual violence is a pervasive and complex problem that affects millions of individuals worldwide. While the terms used to describe it, such as rape, sexual assault, sexual abuse, and sexual violence, are often used interchangeably, it is crucial to recognize that these terms can carry different meanings depending on the specific context and location. Moreover, the legal definitions of sexual violence can vary significantly from medical and social definitions, and these legal definitions themselves can differ between and even within countries. This inconsistency underscores the importance of healthcare professionals possessing a clear understanding of the legal definitions of sexual violence within their own jurisdictions, especially concerning the age of consent and marriage. Sexual violence encompasses a wide array of behaviors, including any sexual act, attempts to obtain a sexual act, unwanted sexual comments or advances, and acts to traffic women's sexuality, all involving coercion, threats of harm, or physical force, irrespective of the perpetrator's relationship to the victim or the setting in which the violence occurs. This definition illustrates that sexual violence is not limited to physical acts of rape, but also includes various forms of coercion and manipulation. Defining sexual violence.
Sexual violence refers to a wide range of behavior including rape, sexual assault, harassment, human trafficking, forced sexual exploitation, and forced prostitution. It can be committed by stranger, acquaintance, intimate partner, or even family members. Sexual violence is not limited to any specific setting. It occurs in private space such as home and residence, as well as in public place like workplace, school, prison, and conflict zones. Understanding the scope of sexual violence is essential for developing better prevention strategies and improving the response of survivors.
Sexual violence manifests in many forms and under diverse circumstances. It can be perpetrated by a single individual or multiple individuals, as in cases of gang rape, and can be either premeditated or a sudden attack, although it frequently occurs in the victim's home or perpetrator's home. It can also take place in various other settings, including workplaces, schools, prisons, and public spaces. The perpetrator may be someone known to the victim, such as a date, acquaintance, friend, family member, intimate partner, or even a stranger. It is important to dispel the notion of a stereotypical perpetrator, as sexually violent individuals come from all walks of life, regardless of their socioeconomic status, education, or religious beliefs. I think nawala po si Kyla Marie, so I'll continue na lang po. One of the major
Sorry po.
challenges in okay. Okay, bumalik ka na pala.
Ayun. The problem of underreporting. One of the major challenges in addressing social violence is underreporting. Many victims choose not to report their experiences due to fear of retaliation, social stigma, or lack of trust in law enforcement and legal system. Victim blaming and cultural attitude often discourage survivors from coming forward, making it difficult to hold perpetrators accountable. As a result, many cases remain unresolved and justice is not served. Encouraging reporting and creating a supportive environment for survivors is a crucial fight against sexual violence.
Underreporting is a major issue, leading to published statistics that do not accurately reflect the true extent of sexual violence. This underreporting is attributed to various factors, including fear of retribution or ridicule and a lack of confidence in law enforcement and healthcare professionals. Men are even less likely to report being victims of sexual violence, further limiting the available information on sexual violence against males. Similarly, establishing accurate incidence and prevalence rates of child sexual abuse is challenging due to underreporting and variations in definitions across countries. Studies suggest that a significant percentage of girls and boys have experienced child sexual abuse, with girls being more frequently victimized. The trafficking of women and children for prostitution is a rapidly growing area of international criminal activity, and women of lower economic status are particularly vulnerable to sexual slavery, trafficking, and sexual harassment. Motivations behind sexual
Contrary to common misconception, sexual violence is not about sexual desire. It is about power, control, dominance. Perpetrators often commit these acts to exert control over their victims, inflict humiliation, or seek of revenge. In some cases, sexual violence is used as a tool for war punishment or apprehension. Understanding the motivation behind sexual violence can help in developing more effective prevention strategies and support system for survivors.
The dynamics of sexual violence are complex, with driving forces and motivations that have been extensively analyzed by researchers. Sexual violence is fundamentally an aggressive act, with power and control being the primary underlying factors, rather than a mere craving for sex. It is often a violent, aggressive, and hostile act intended to degrade, dominate, humiliate, terrorize, and control the victim, violating their sense of privacy, safety, and well being. Myths and misconceptions about sexual violence.
There are many myths surrounding sexual violence that contributes to victim blaming and discourage survivors from seeking justice. Some believe that sexual violence only happens in dark alleys by strangers, but the reality is that the most perpetrators are known to the victims. Others assume that the only women are victims, but men and children can also suffer from sexual violence. Another harmful misconception is that a lack of physical injuries means no assault occurred. In reality, many victims do not resist due to fear of coercion, and injuries may not always be visible. Addressing this misconception is essential to create a social that supports survivors and holds perpetrators accountable.
The reality of sexual violence is often obscured by misconceptions and myths. These myths are which are frequently perpetuated by societal norms and cultural beliefs about appropriate sexual behavior for men and women, can hinder efforts to address sexual violence effectively. In many societies, men are viewed as the sexual aggressors, while women are expected to be sexually passive and engage in sexual activity only within marriage. These prevailing myths shape societal responses to rape and rape victims, often leading to victim blaming and a lack of accountability for perpetrators.
The role of forensic examination. Forensic examination is a critical part of investigating sexual violence cases. Medical professionals plays a key role in collecting evidence, documenting injuries, and conducting tests that can support and refute claims of assault. This process includes gathering biological evidence such as semen, saliva, epithelial cell, as well as conducting toxicology tests if drug facilitated assault is suspected. Proper forensic examination not only strengthens legal cases but also provides essential medical care to victims.
The forensic examination in alleged sexual assault cases is arguably one of the most comprehensive applications of forensic medicine, whether we are dealing with with a living patient or a deceased individual. The meticulous detection of injuries in biological materials is paramount.
Genitoanal examination and injuries documentation. Medical professionals conducting forensic examination assess injuries in various areas, including the genital, anal, and oral regions, depending on the nature of the assault. This process requires the use of specialized forensic tools such as colpo- colposcopy and magnified examination. Blue staining to detect microinjuries that ultraviolet light to identify biological fluids through documentation of injuries is essential in legal proceedings as it provides evidence to support the victim's testimony.
This process demands a systematic approach, a thorough understanding of the genitoanal anatomy, and the complexities of sexual physiology. Our goal is to ensure that the evidence we collect is robust and reliable for the courts.
Challenges in injury detection. One of the challenges in forensic examination is that many victims of sexual violence do not show visible injuries. This can occur for several reasons, including nonviolent coercion, the natural elasticity of genital tissues, or delay reporting, which allow injuries to heal before examination. The absence of injuries does not mean that an assault did not occur. Medical professionals must be trained to recognize both physical and psychological signs of trauma to provide accurate assessments. Sexual assault. Number one, importance of biological evidence. Biological evidence is one of the most crucial aspects of forensic examination in sexual violence cases. Key types of evidence include sperm and semen, which can be used for DNA identification, saliva, and sweat, which may be present on the victim's body or cloth, coating, and epithelial cell, which can confirm physical contact. Proper collection and preservation of biological evidence are essential to ensuring accurate forensic results and preventing contamination that can lead to wrongful conviction or case dismissal. 2. Legal, eth- legal and ethical consideration in sexual violence cases. Medical evidence does not prove or disapprove consent. Court considered multiple factors when evaluating sexual violence cases, including witness testimonies, behavioral patterns, and circumstantial evidence. Medical professionals have ethical responsibilities when handling these cases, including maintaining objectivity, ensuring that examinations are conducted sensitively, and protecting victims. Confidentiality, a collaborative approach between forensic experts, law enforcement, and legal professionals is necessary to ensure justice for survivors. Number three, the role of medical practitioners in court. Forensic medical professionals often serve as expert witnesses in court, presenting medical findings to support or challenge claims of sexual violence. Their role is not determining guilt or innocent, but to prove scientific, evidence-based of examination that assist the legal process. Medical practitioner must be ensured that their findings are presented early and without bias, focusing on the medical and forensic aspects of the case. Number four, the impact of sexual violence on victims. Sexual violence has served as a long-lasting effect on victims. The psychological impact includes post-traumatic stress disorder or PTSD, depression, anxiety, and self-harm. Victims may also face social consequences such as stigma, family rejection, or job loss. Physical health risks include sexual transmitted infection or STIs, unwanted pregnancy, and long-term reproductive health complications. A survivor-centered approach that provides medical, psychological, and legal support is essential to helping victims recover.
Standardized protocols for forensic examination and evidence collections are essential tools. They streamline the investigative process and increase the likelihood that medical evidence will be effectively utilized. However, it is critical to remember that while injury can indicate penetration, it cannot definitively prove non consent, as injuries can also occur during consensual encounters. Biological evidence, such as semen, sperm, or saliva, can establish contact or penetration. The weight given to injury in biological evidence by legal professionals will vary depending on the specifics of each case, such as proving contact or corroborating a physical struggle. Because the forensic examination often occurs early in the investigation, before all the facts are known, the examiner bears a significant responsibility to conduct a comprehensive examination and collect all potential relevant evidence. Poorly collected or insufficient evidence can be a major impediment to the successful prosecution of sexual assault cases.
Improving the response to sexual violence. To improve the handling of sexual violence cases, society must encourage victims to report assault by strengthening support systems such as crisis center and hotlines. Law enforcement must be trained in handling cases with sensitivity and professionalism. In medical field, standardized sexual assault evidence kits use, should be used, and medical professionals should be trained in trauma informed care. Legal and policy reforms should focus on protecting survivors, ensuring fair trials, and holding perpetrators accountable without victim blaming.
While it's true that sexual assault doesn't always result in visible injury, the presence of injury, even minor, can significantly influence decisions throughout the legal process. Effective communication among all parties involved in the investigation, police, medical examiners, lab professionals, lawyers, and judges, is crucial to ensure that forensic medical evidence is used appropriately.
In conclusion, sexual violence is a serious crime that requires a combination of scientific, legal, and ethical approach to address effectively. Forensic, medic- Forensic medical evidence plays a crucial in legal proceedings and help ensure justice for survivors. Proper training for medical professionals, law enforcement, and legal experts is essential to proving the case outcome. Combating sexual violence requires a collective effort from society to create safer environment, support survivors, and hold perpetrators accountable.
In this conclusion, the forensic examination of sexual assault victims is a complex process that demands meticulous attention to detail, a thorough understanding of anatomy and injury patterns, and rigorous adherence to evidence collection protocols. Effective collaboration among medical professionals, law enforcement, and legal practitioners is essential to ensure that medical evidence is accurately interpreted and utilized to serve justice and support victims of sexual assault. And that is all for today. Thank you for listening.
Thank you po.
Doc, may I present po yung isa pong PowerPoint namin?